Estás viendo Canal América, televisión dominicana para el mundo.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to a Time for Truth show. It's a pleasure to have you back again with us. I'm your host, Dr. Bernard Fialkoff. And to begin, a lot of you have been asking, how do I get the previous episodes? So you go on YouTube, you click a Time for Truth show and click subscribe, and you will have access to all our previous shows and segments. So we're going to get right to the show tonight because we have so much to cover. And something that's going on right now in our country, it's been devastating. Violence, shootings, and something very important, which is at the base of all this, and needs to be addressed, and it will be addressed tonight by an expert that we have with us. Drugs, the association of illicit drug usage and the violence and the killing. So drug abuse is accompanied by a devastation of our communities, and with the social impact that you have is devastating. The local industry, the educational institutions, and the family structure are worsened. Violence, crime, financial problems, nursing, housing problems, homelessness, all of these are associated with the drug use. And you know, it's time that we did something about it and we move forward. So tonight's show, we have special guests, an engineer, Buddha. If you can put his pictures up on the screen. I want to introduce Dr. David Ehrenkrantz, a native of Philadelphia and health and human services expert. There you have him. He holds a doctorate in public health from the University of Pittsburgh, and he's devoted himself to government service, research, teaching, and project development, being endowed by such important organizations such as the Center for Disease Control, the National Institute of Health, and the Health Resources and Services Administration. He is Vice President for Health and Board of Directors for the World Conference of Mayors, directed by the Honorable Johnny Ford. David is coordinator in collaboration with state governments and to achieve common goals and purposes. He uses public and private data sources for services development with people with disabilities, maternal and child populations, traumatic brain injury, and children at risk for lead toxicity, Alzheimer's, pediatric HIV, health, education, and development disabilities. Mr. Ehrenkrantz is head of the Domestic Leaders of Philadelphia, an international organization to fight global poverty. He chairs the Advocacy Committee for Partners in Health in Philadelphia, presenting health services around the globe, and he's been published in the Journal of Neuropsychiatric Genetics, the Journal of Rehabilitation, and the Journal of Disability Policy Studies. His work, he's received grants from the CDC, the Health Services Research Administration, and the State of New York Department of Health. David has created and maintained viable working relationships with federal legislators and the staff to advocate for legislation and to create greater opportunities globally and domestically for access to health and education. Mr. Ehrenkrantz, actually Dr. Ehrenkrantz, has been included in numerous editions of Who's Who in America in medicine, science, in the East and the Midwest, as well as being in board membership for the Kensington Community Corporation for individual dignity. At the end of 2022, the international meeting of the World Conference of Mayors, Dr. Ehrenkrantz was given the Dr. David Satcher Award for his work in global and domestic health advocacy. He also has been honored with the Rotary International Award for vocational training, sending a team of trainer nurses to help in Haiti. Really is very diverse and active in a plethora of different fields, very important for what's been happening in all our cities, in New York, in Philadelphia, and across the country. And so, Buddha, if you can bring him up live, we want to welcome Dr. David Ehrenkrantz to a Time for Truth show.
Well, thank you. You had asked me, incidentally, for those of you who are out there, I do have a vocal cord disability, so just bear with me. Thank you. You asked me how I got involved with all of the things you just beautifully described. I was a MSW social worker working in the Bronx and Queens, largely with the population that was mentally retarded, but I also was working with recovering alcoholics and drug addicts. Public health offered me an avenue to understand more about what I was working with and struggling with every day. It also opened up a doctoral track because I love to do research, and one needs a doctorate to do that. So, as you've mentioned, I wound up at the University of Pittsburgh and took my doctorate in public health there. Subsequently, I went on to work for state governments in an epidemiologic capacity, CDC funded. Now, one of the main objectives of these roles I was undertaking was to bring state government and academia closer together. So in Kansas, I was the disabilities epidemiologist for the entire state, but I was also given an assistant research professorship at the University of Kansas School of Medicine in health policy. Now, this was good for me. The problem with the epidemiologic field, especially in state government, they have a lot of good data, but they don't use it sufficiently to develop meaningfully preventive community health services. The beans are there. They count the beans, but they don't prevent the beans.
Well, you know, David, that's why I wanted you on this show, because I see that you work and you get products. You actually gear yourself to solutions at the end of the programs that you present. So what I wanted to ask you is, I see that you're a board member of the World Conference of Mayors, which is directed by the Honorable Johnny Ford, who's president and founder of the World Conference of Mayors and the Historic Black Towns Settlements Association. And so what I wanted to ask you, as vice president of their health affairs, what is it? What are your responsibilities and working on with them?
Well, you mentioned my membership in Results and Partners in Health, where I've been doing a lot of advocacy with Congress. You and I tend to be one of a handful of, I'll say it, white people who come to the conferences at the World Conference. So what I have been doing is tying in my congressional advocacy work domestically and globally with what Mayor Ford and the board of directors would like to see happen health-wise. And there is a complete overlap. For instance, you showed some pictures of Mayor Ford's team and myself in Marrakesh getting off the plane. Right now, I've lobbied Congress to raise $300 million for global nutrition, to give $2 billion for the Global Fund to fight AIDS, TB, and malaria. Domestically, the child tax credit was stopped. I've tried to work with Congress to see what can be done with the Budget Reconciliation Act that's now being discussed in the Senate. These things have a heavy negative influence, the cutting of the child tax credit on the African American community. It affects housing. It affects access to health. It affects African American people being able to go back to work because it cut child care. How can they go back to work and leave infants and children in the lurch? So these are some of the things I've been working on and reporting on every week for Mayor Ford and for the World Conference.
Very interesting. Well, those are very important fields because obviously it's part of our United States of America. These are the youth. This is the future of the country. And, you know, and you're looking at really bringing people together. It's so important. I know Mayor Ford has really been very positive on educating against drugs, and he's really been happy about the Drug-Free World program. But I want to ask you, you know, because I am involved in that field like you, what, as chairman, because you're chairman of the Philadelphia Advocacy Committee for Partners in Health. So as that role and chairman, how do you view the present violence and drug situation that's occurring in Philadelphia?
We're going to have to sit down with all the relevant players, starting with Mayor Kenny and his office and his planning committee. Then we're going to have to include members of the city council. Everybody agrees with the problem, but they're not all on the same page as to how to solve it. I would then also like to get Congressman Dwight Evans, whose jurisdiction is West Philadelphia. Congressman Evans is an active member of the Black Congressional Caucus. He's also a former school teacher. A couple of summers ago, when the rioting was going on in all of our cities, most of it here in Philly was occurring in West Philadelphia. We have to get them involved. the east side, we have Congressman Brendan Boyle. One of his district aides, Anthony Bellman, is African American. We've been working with him. They are congressionally responsible for the jurisdiction that contains Kensington. How did I get directly involved? About 4 years ago, give or take, members of my partners in health chapter came to me for help. They needed funding to continue doing what they were doing. They came to me. We sat down with some of the human service agencies in Kensington. Kensington is a dangerous and drug-ridden area. We needed more money because every Sunday these people from my chapter were going into Kensington and distributing Narcan to prevent overdose and cleaning up the streets and areas of that neighborhood. Some of them were medical students at Penn, at Jefferson, at Drexel, and at Temple. They also wanted to create a safe injection site. Subsequently, altogether, we got a very large town hall meeting right on the main track of Kensington at one of the community centers. I don't remember the name, but was named after an Hispanic American priest from the area. Everybody got up and spoke. What was evidence was a 50-50 divide. Obviously, business people weren't happy about the idea. Somehow, approval was successfully obtained for a safe injection site near a hospital. Before any of that could go ahead, members of the community and some members of the city council were able to block implementation through use of federal legislation. Ben, I agree with you. That would have only been one part of the problem addressed. 2 Saturday evenings ago, as you and I were leaving Orlando at the World Conference of Mayors meeting on South Street in Philadelphia. This was around 11 p.m. on a Saturday night. We had our first incident of a mass shooting. A fight broke out among some members of the African American community on South Street in the middle of a crowded area. South Street is our answer to Greenwich Village. It's artistic, but it's always crowded on a Saturday night. Tempers were lost. Guns came out by the people, the 3 or 4 people having the altercation. And in one of the videos I sent you, I think there is a videotape
Yeah.
on a camera. Unfortunately, 3 people died. I think 11 more are hospitalized.
And you had told me also that as far as you knew, that broke out over some kind of drug sales or trafficking, right?
I can't be sure. The police have apprehended the perpetrators in Richmond, Virginia. They still have not revealed a motive. I do have statistics on drug-related shootings in Philadelphia for 2021. 20% of those shootings were drug-related.
Wow. Wow. Well, you know what? Let's put on the videos that you sent. Engineer, do you have those ready? Let's put on the first 2 videos, please. And let's let the audience catch up with us, Dr. Ehrenkrantz. Here we go.
Anytime it happens. In the grocery store, you know, at the elementary school, in the hospital. A hospital is supposed to be a place of safety, and you have people fearing for their life in the situation that they're in. I couldn't imagine that. Like I said, I couldn't imagine my sister not coming home from high school. My grandmother not coming home from the hospital where she's supposed to be cared for and safe, you know, and we just gotta change.
It's been a tough year in Philadelphia in so many ways, from the stress of the pandemic to the unending gun violence to calls for change in the wake of civil unrest. It's been a lot. In an exclusive one-on-one interview, I spoke with Philadelphia Mayor Jim Kenney about the issues facing the city and how he hopes to improve it. People in the city not feeling safe here, not feeling like it's a safe place to raise their children. And it's not just the people who live here. What do you think this is doing for tourism, for the families who live just outside of the city but might commute in, or they might want to come in on the weekends, but they don't feel that Philadelphia is a safe place to be?
Philadelphia's Part 1 crimes are down, as in most big cities. The one issue that we're dealing with that's very serious is shootings and homicide. And it's generally in a group of people that are amongst each other. They're warring groups in the city who live in neighborhoods that are impoverished, who feel no hope, who have no opportunity because of all that's going on, or the fact that they haven't gotten a good education and can't get a job that pays a living wage. And they're the ones that are hurting each other.
Well, you know, there you have what we've been talking about. And, you know, you and I and the World Conference of Mayors and the Globetrotter players headed by, you know, Bobby Hunter, and I representing the Drug Free World Foundation, its education program. And in Orlando, we held a basketball game. And the basketball game with the Globetrotters was to get youth and the parents, you know, aware of a solution, because the United Nations in 2016 at the World Drug Conference came up with the fact that education was going to be the key to this drug problem. And that, you know, you and I, like you said, you had statistics, and I also, that drugs are associated with a lot of these shootings. And obviously these people have some type of problem going on, and they're trying to evade it, and they're on drugs, and then they shoot people, and violence occurs and crime. And, you know, we were talking, so, you know, you had mentioned, we all have very short time, but that possibly we could organize a basketball game in your community there, right?
Definitely. And incidentally, the first person you just saw interviewed is a Philadelphia Eagle football player. I forget his name, but we may want to contact him. That Kensit group you mentioned, we actually were successful in getting an Eagles player who had a retarded sister to do publicity work for us. As soon as we did that a couple of months ago, he got traded. but we'll try to get this fellow involved. Now, getting back to your point, I think perhaps a viable way to kick things off would we should do things a little backwards. I think I'd like to go to Matt Holcomb, who is domestic aid for Congressman Evans, and discuss what we just saw with him, and then suggest to him that we have this viable educational and prevention program, and that we do have the commitment of Bobby Hunter and his other Harlem Globetrotter alumni, and that they've helped us out and staged an awareness game both in Tuskegee in March and in Orlando the other week. And see, we were working on a project with one of the other board members of the World Conference, with Matthew, and we had to put that on hold because the project involved a huge convention with literally thousands of people globally and domestically coming to the Pennsylvania Convention Center. And I think the board member had been hoping to execute this in a matter of months. Can't be done in Philadelphia. Very likely in New York, but not in Philly. So Matthew was working with us and making contact with Mayor Kenny, his planning committee, and the city council. So I think with this, Ben, we can go back to Matthew and say, this is a much smaller problem to work on, although the problem and the population it addresses in Philadelphia is horrendous. But we have the use of Ben's organization and the Globetrotters, and maybe we could get this Eagle football player involved. I think that would carry a lot of weight.
Yeah, absolutely. Dr. Ehrenkrantz, I wholeheartedly agree with you. And, you know, I think that because there's been so much killing, we don't want any more people killed. Mayor Kenny's trying to do everything he can. I know in New York City, Mayor Adams is working really relentlessly on this. And Bobby Hunter is very steadfast on this. Myself, with representation of, I represent the Foundation for Drug-Free World Education, the largest NGO in the world for drug education. With you, let's get this going on. Also, I want to mention that an ex-Philadelphia 76er who's a great guy, Wally Jones, who played with Wilt Chamberlain, he wants to be involved. In New York here, we have a New York Jet, Noah Burrows, who's doing a basketball game in Hempstead, where he's actually in politics right now, and he's part of the town council. So let's get all together, and it's been a pleasure having you on the show. Unfortunately, we ran out of time. We're going to have you back again.
My pleasure. Look forward to it. And
absolutely. Absolutely. And I also want to mention our buddy, Mayor Ford, with the World Conference of Mayors. And you know what? Let's all get together. Let's get this basketball game and education going, and let's do something positive. Let's try to give some of these people who are suffering, who obviously are stressed out, let's deal with them in a human way, and let's solve the situation. Thank you, Dr. Ehrenkrantz, and thank you out there for all of you who are going to be doing things with this, I know, and we will move forward on this violence problem, this killing problem, the drug problem, and get it under control together. Thank you very much, and we'll see you next time.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. But the world takes you down. You just keep moving on. Let your feet